this is an innovation we've been looking for. And for Arise Hospital, we are very, very grateful to have this kind of innovation at our facility, the very first one in this region, in Africa.
It has been totally different when handling the patient from previous ways we've been handling patients with the other beds. What I can actually testify with this bed is there is actually limited cross-infections between patients and we healthcare workers.
As time goes by, the healthcare industry experiences changes. One constant thing, however, is that people keep getting sick, more get older and frail and need help. With the increase in need, it is unfortunate that there aren't many caregivers getting into the market. This therefore demands for a solution. Ezra Nyankira, who hails from Kisii County, Kenya, and is currently based in Dallas, Texas, has invented a solution meant to make caregiving seamless. He is the inventor, founder, and president of EasyDrain Care Products. The EasyDrain bed, which is meant to offer comfort to incontinent cases, is a game changer in the healthcare industry.
Several years after being in the healthcare industry as a nursing assistant, I became a nurse, and as I was working in the community, I took care of a lot of people in their homes, sometimes in the hospital or in nursing homes. But the idea came about really when I was taking care of this couple, a man and a wife, and the wife was bedridden, and the man was able to get around but could not really take care of his wife because he was too old and frail. This particular incident, I was working for a home health company, and I was the wound nurse. I could go around from one home to the next and take care of people with wounds. And then I go home. And then this lady, I noticed that every time I came to see her, the wound was getting worse, and I was wondering, I'm doing all the best I could do, and they give me all the equipment and products which should take care of the wound, but the wound was not getting any better. And I then noticed that every time I came, changed the lady, did the dressing, and I put her in a diaper because she was incontinent. I noticed that every time I came back, she had the same diaper I had left her with the previous day. That's about 24 hours. And now her skin was being eaten up by the urine. And then that's when I started thinking there gotta be a better way of taking care of people other than just putting them in a diaper and leaving them. At that time, I got this idea that what if we had a mattress which could let urine flow through and the patient could remain dry.
The beds have found way into Kenya, and the Rise Hospital based in Ruiru is the first user.
When I was doing research and crafting what we can do, I've seen a lot of innovations going around, and we were still looking what kind of innovation that can help our people in this community. Because we take care of fragile people who are bedridden, who are incontinent, and who need comfort to sleep and be taken care of. And we have come to such a conclusion that there is an innovation which has come out. The EasyDrain bed, which is a good innovation for our hospital, which can take care of our elderly and the very sick, prone to diseases which people are immobile and they spend most of their time in bed. This is an innovation we've been looking for. And for Arise Hospital, we are very, very grateful to have this kind of innovation at our facility, the very first one in this region, in Africa. A very great innovation for us.
This bed I can use for all patients I handle. The critical patients who are paralyzed, the ones who have urine incontinence, who have stool incontinence, I can easily use the bed because as the patient they relieve themselves, the bed himself is going to drain the incontinence, the urine or the stool. And the bed is very hygienic because you can sanitize the bed and also it drains by.
It has been a very good experience to be part of this first experience with this innovative bed. Actually, what I can just say that it has been totally different when handling the patient from previous ways we've been handling patients with the other beds. What I can actually testify with this bed is there is actually limited cross-infections between patients and we healthcare workers.
We hope that very soon, in a couple of months, we'll have to have several of those units in hospitals around Kenya and East Africa, and then eventually the rest of Africa. Right now, most of the units we have are here in the US. They are being used in various settings, and we are getting great reviews. People are liking the product, and we are seeing the momentum that actually this has been a product people have been waiting for, only that it wasn't available.
Ezra and Tim have a 10-year plan for the healthcare industry.
That in the near future, most companies, whether big or small, will have to adapt the technology we have brought to the market for healthcare equipment. So yes, in the next 10 years, we hope to be a major player in the healthcare industry, and hopefully that will bring some relief and help to the people who need it most.
Ezra has a word for the youth with innovative ideas.
I know where I come from and the friends I have had, and looking at people in general. I know young people out there are innovative. They have ideas, but a lot of people hold them back and think that that's a stupid idea. I'm telling you, if you see a problem and you see a solution, I could tell anybody, give it a shot. Don't just think that it's stupid. Why I say that is when I started this journey, I talked to a lot of people. And some of them laughed at me, and some of them told me I am so sick. How could I be thinking of something like that? That is something which should be left to women nurses to think of something like that. But when you see a problem and you have an idea to solve it, I will urge everybody to put that idea forward. It could help humanity.